Good morning, everybody. I think we're going to make a start. My name is Lusanda Ngoliwe. I am one of the partners in the Greer business. I'll be hosting you this morning and taking you through the session. May I please kindly ask that everybody mute their mic and switch off their video unless you are speaking. I'd like to invite everybody to please post their questions on the right-hand side where you see the bubble for communication. Please post your questions there. We'll take a note of the questions and then we'll put them through during the Q&A session. Next slide, Telly. So this morning we've put together a panel for you. And this panel is to help the Social and Ethics Committee put some considerations during this time of the COVID pandemic. We hope this session will be very useful to you and will give you great value. In front of you is the agenda of what we're gonna go through this morning. So our session is about 90 minutes. Of which 60 minutes will be used for the speakers, and then we'll have a 20-minute session of Q&A at the end. I invite you, as we go along, if you think of something, please type your questions in the communication tab on the right top-hand corner of your screen, and we'll be sure to answer those questions. So at the beginning, we'll start off with Lulu Krugel, who will start us off with the economic considerations that the Social and Ethics Committee should be considering during this time. So Lulu is a partner and a chief economist at the PwC South Africa office. And she leads a team of 10 consultants, and then they focus on economic impact assessment, regulatory impact assessment, market entry studies, and behavioral economics. Experience spans over 18 years as an economist, and the majority of this time has been spent as a consulting in the consulting environment. Lulu has spent some time lecturing economics at the University of Johannesburg and the University of Northwest in the Potchefstroom campus. She's a regular commentator in the media on economic matters, economic development, and she also presents in national and international conferences. She's spent a bit of time with some clients like Sasol, Vodacom, ABSA, Gautrain, Nedbank, to name a few. Her qualifications are a master's degree in economics and risk management. She also holds a postgraduate certificate in energy law and competition law. Lulu is not just an economist, but she also is an avid runner, and also you would also find her singing as part of her choir. Can we please welcome Lulu Krugel to take us through the economic considerations at this point?
Thank you very much, Lusanda. Good morning, everyone. So looking at the economic impact of COVID-19 is quite a complex and a difficult task at this point in time. So I'm going to share with you the way that we've been thinking about this over the last couple of weeks. So firstly, in terms of where the economy was at the beginning of all of this, and I think we sometimes forget that we're already in a tough position, and that COVID-19 has only exacerbated quite a few of the problems that we've had beforehand. Things like load shedding, for example, a lot of us forgot about that, but unfortunately we know that that will be back at some stage when the economy is up and running. So what you see on this slide is basically just an indication that the economy was contracting at the end of 2019. We were in what we call the technical recession. Combined with that, government's deficit, budget deficit, was close to 7%, and overall debt to GDP was, edging towards 70%. So all of this, of course, means that we have less room to respond from a fiscal perspective and to actually, inject a lot of additional money into the economy. And it has left us in a position where, from a fiscal perspective, there's not too much room to move, and we will have to rethink this. We also know that because of where we were, and not necessarily of COVID-19, we've seen downgrades by Moody's, which now puts us in so-called jug status, and further downgrades by S&P and Fitch. But on the good news side is, whilst we expected massive outflows out of the bond market, some people were saying up to 500 billion, others were saying 200, 250. It ended up being in the region of 70 billion rand. It's a lot of money, don't get me wrong, but it's significantly less than most economists expected. So it just shows that the rest of the world is looking at returns. Our bond market at this point in time, with yields in the region of 9%, actually, looking attractive. So with net outflows of 70 billion, on the back of that downgrade, we actually came out of it a little bit better than we expected. Next slide, please. Thank you. So what we see there is just this push and pull between the lockdown and more severe containment policies and the economy. So the more severe the lockdown, the bigger the impact on the economy. We do understand that. And it's interesting to see the interplay between different countries that either decided not to have these severe lockdowns and others that did. One example is Sweden, for example, where it's left up to the population mostly to decide how they want to, implement social distancing, etc. And the irony is that, in spite of that, the Swedish economy is also going to take quite a severe hit because of demand for their goods and services, and also because a big company like Volvo couldn't get supply for their products. So I suppose at the end of all of this, we will actually see what has been the correct decision. But we do know that, the lockdown is quite a severe shock to the economy. Next slide, please. So how will the economy recover? We're hoping for the middle scenario, a U-shaped scenario. We think it's unlikely that we'll see a very quick bounce back, the so-called V-shaped scenario there. China might be heading towards that, but we don't know if that would be sustained, given the fact that the Chinese economy is so dependent on global demand and global exports. So depending on how the rest of the global economy reacts, China will probably also at a so-called U-shaped recovery. We're hoping really that none of the countries globally get stuck in an L-shaped scenario where we have, for a prolonged period of time, have a situation where we're stuck at lower growth levels overall. Next slide, please. So what we see here is basically that every part of the economic value chain has been negatively impacted by COVID-19, from households to business to government income through taxes to the financial sector to exports and imports. So literally every bit of it almost immediately and directly impacted. And if we think about responses, that is what we need to keep in mind. How do we, first of all, address the healthcare challenge? Secondly, how do we address what is happening with households and keeping food on the table? How do we address what is happening to businesses and keeping them afloat? And how do we rebuild the economy? Next slide, please. So in terms of the share of GDP of our response, the 500 billion in fiscal commitments, it's equal to about 10% of GDP. So quite a big relative to a lot of other countries. But if we do keep in mind that only about, in our opinion, around 160 of that will be a real injection in the economy, the real impact on the economy is going to be less. It's not to say that the guarantee systems, loan guarantees, etc., that's been put into place is not important. Next slide, please. Okay, then in terms of the impacts, As I said earlier, almost every part of the value chain being impacted. We looked at supply chain disruptions, disruptions in labor supply, business and consumer confidence, sector lockdowns, and then of course the policy response from government. And then all of that has given us some insights in what might happen to specific industries. Next slide, please. Okay, next, yeah, there we go. So what we looked at is what would happen to specific industries. The type of model that we used is different to the normal model where we look at historical data that economists normally do when we forecast what is going to happen with the economy. Because of the severity of the shock, we know that you know, our typical models won't be able to understand that and you know, keep that in mind and actually give us proper results. So what we used is what is called an input-output or social accounting matrix approach of the South African economy, where we looked at all the linkages between the different sectors in the economy. And through that, we could understand what the impact would be on the different lockdown levels. That is what you see there in the middle. If we're at lockdown level 5, what the potential contraction is in the economy if we're there for a month compared to, let's say, a month last year. And so we go through all of the different lockdown levels and the impacts. If you look at lockdown level 1, or alert level 1 rather, you would see that we're still forecasting a minus 9.9% contraction there. And the reason being is that business confidence and business investment would probably not be back to its normal level. And in addition to that, we also don't think consumer confidence will be back to its pre-COVID levels, and export demands and also the tourism sector would all still be impacted. So just next to that, you will see a scenario that we've put forward about how we could potentially move through these lockdown levels. And this is based on what we see currently as government's policy from a healthcare perspective. So there's been talk that if infection rates spike, certain parts of the economy might go back to higher alert levels. The practicality of that is still a question, but that is what we assumed there from July onwards, and then a gradual reopening of the economy. Of course, this could change, and the slower we go through the lockdown levels, the more severe the economic impact, and vice versa. In this particular scenario, we get to a contraction of minus 18.1 over until the end of next year, until the end of this year. But if you take into account the fiscal injection that we spoke about earlier, that 500 billion, and also the monetary policy investments or interventions through the cutting of the interest rates, as well as the open market transactions, then that could bring us back to around minus 11.7%. Next slide, please. Okay, so we have some sector impacts here. I'm not going to go through them in detail due to the, in terms of the interest of time. But what we do see is that in particular the manufacturing sectors being very hard hit. In terms of agricultural sectors, or the agricultural sector, a bit of a mixed bag there because people still need to buy food. If you can move to the next slide, please. Yes, there you see some of the manufacturing sectors there at the bottom, and them being heavily impacted. Next slide, please. Still more manufacturing. Sorry, we went into quite a bit of detail around manufacturing. And then if we get to finance and, the financial and insurance sector, etc., some of those also being quite negatively impacted, and that's due to the linkages with the rest of the economy. So our banking system being stable, we're not worried about that, but unfortunately we do know that the banking system will also be negatively impacted by COVID. And yeah, that is me.
Thank you so much, Lulu, and thank you for putting all this into perspective for us, because we see ourselves being in a lockdown, but to have someone who actually puts this into a model and sort of give us an impact of what is happening, I think from my side, what I would ask is that in economics, all the factors usually have, different effects. Some effects you see immediately, but my interest is to say, are there elements that you think are going to have a lag-on effect? So we'll only see it much later, the effect of what's currently happening now.
Lusanda, very valid question. One of the most important impacts on the economy, for example, will be business investment and what will happen to business confidence and business investment. And how quickly business and consumer confidence bounce back will have a massive impact on how long the negative impacts of this will be on the economy. So getting business confidence and business investment back to pre-COVID levels is very important. But from historical situations like the 2009 financial crisis, we realized that takes time. In addition, also what will have a very big impact on our ability and the speed of bounce back is what will happen in the global economy, in particular with our major trade partners like the US, the UK, China and Germany, amongst others. So those are economies that we are watching very closely.
Sure. Thank you so much, Lulu. We appreciate that. I think next up on our agenda, we're gonna have Dane speak to us. He is gonna be concentrating on enterprise risk management considerations for the Social and Ethics Committee and what the committee should be considering during this time. Dane joined PwC in January 2018, and he currently leads the Gauteng Governance Risk and Internal Audit team. He's one of the most experienced internal audit practitioners in SA. He has 33 years of audit experience, and of those 33 years, 28 years has been dedicated to the internal audit field. He's worked at an in-house internal audit in different areas as a CAE in steel, forestry, mining sectors, prior to rejoining one of the big four audit firms, KPMG, about 16 years ago. He has, at that point, been in various leadership roles, including being the global leader in mining internal audit assurance and integrated assurance team. He's got a long-standing relationship with many teams. As you can imagine, in the 33 years, he was able to have lots of relationships that he has built over the years.
All right.
Dane, please take us through what you think the Social and Ethics Committee should be considering in terms of ERM during this time.
And I think perhaps before we, thank you very much, Lusanda. And I think perhaps before we start, we could just move the page. There's a polling question. Has everyone set up their polling servers in terms of how to answer this? And this is a question we want to pose to everyone. And one of the key governance measures required to ensure assurance activities are realigned with the increased exposures brought about by the COVID-19 pandemic is an updated risk register. And the question is, has your Social and Ethics Committee received an updated risk register and realigned short-term assurance plan for the risk areas that it is responsible for overseeing? All right, so first answer A, yes, register updated, realigned, and a realigned assurance plan approved. Or B, yes, register updated, but assurance plan not yet realigned. Or C, no, awaiting both updated register and realigned assurance plan. All right. We could answer those on that website, and we can come back to the answers there. So please turn over the page so long. All right, so I've had a number of deliberations with a number of companies in the last couple of weeks, and There are a couple of companies at the moment going out on their road shows, pending their last results announcements. And the one question that came up was, you know, how do we deal with the risk section in the governance report? Excuse me. And that elicited a lot of deliberation with regards to the various aspects and approaches to be taken. Because right now, as you can well imagine, I think at the forefront of every CEO's mind at this point in time, as well as the chairman and board members of those entities, is one, the health of its employees, obviously in terms of COVID issue, but further to that is just the general sustainability of the business, and in particular the liquidity challenges that this whole COVID-19 pandemic is in fact causing. So the issue really was very complicated to put that into writing in reports at this point, because the biggest challenge that everyone has is we're pretty much 2 months into the pandemic. No one really knows at this point in time, and as Lulu will bear me out, is how long this is going to last and what the real impact is going to be. So how big are these risks? And then the other issue that came up was, you know, if we've managed to prevent someone coming to the site with COVID to the operations, you know, is our system working? And the issue is, look at what's happening out in certain parts of the country, and in particular, some of the mines that are being shut down because COVID cases have arrived at work. The big concern really is if you've got 20 or 30 cases reporting to an operation, the issue is those communities that these cases come from and reside in could in fact cause major outbreaks, in which case you might have your whole labor force laid low due to this pandemic. So this risk issue is a big thing at the moment with regards to all of the board subcommittees. And when we're talking the Social and Ethics Committee, as you can well imagine at this point in time, right at the forefront is health as a matter, of course, in terms of not only making sure that all employees stay healthy as far as possible, and in particular when considering aspects in terms of the executive management team and succession, and trying to protect those senior employees, and as I say, all of them, from falling ill and possibly losing senior executives. A lot of measures are being put in place across the board. But a secondary health issue that is at the forefront of concern at the moment is just the general well-being of employees, considering what is happening at the moment. I was told by someone in one of the major banks that the salary volumes in terms of numbers going through the bank in April was significantly lower than it was in March in a normal month. And you will have noticed across the board, different companies are handling this this particular matter in different ways, and some are being very robust and in terms of how they are cutting their own costs. You know, there have been substantial cuts in salaries from executives right down to low levels across the board. We have had retrenchments that are taking place, restructurings, and a number of significant, let's just put it this way, mitigation strategies being put in place to try and survive this next couple of months. Now, all of these things are having a significant well-being impact on employees in terms of their security of earnings going forward and the like. So that is definitely high up on the agenda for social ethics committees at the moment. When you're looking at other things such as safety and environmental issues, what we are seeing out there is that executives in those areas of the business are taking a sort of an increased look at risk, because it's not business as usual. There are less people operating on site, so the increase in risk for accidents have gone up, as well as environmental incidents. The other issues that are also of concern in terms of contribution to social programs and the like, in terms of, you know, companies trying to maintain its social license, is also going to take strain over the next period, and is also an area that we're expecting social and ethics committees to closely monitor in terms of how those things are happening, because again, flare-ups in those areas could also cause significant reputational damage as well. When it comes to reputation and ethics related exposures, and you're going to hear from some of our colleagues around these at the moment, is that there's a significant increase in the risk of cybercrime right now, and also other theft, because of the nature of and presence of people on site, and also the fact that there are whole significant new ways of working for employees at organizations that used to work behind the desk with a desktop, and now they work from home with a laptop. So there are a number of threats with regards to cybersecurity and the like, and those also need to be on the agenda. So when it comes to things like stakeholder engagement, at the moment, what we are seeing out there that's also a cause for concern is that there isn't necessarily a unified front when it comes to stakeholders at organizations, because what we do find is that the unions are not necessarily, let's say, working with management when it comes to solving these issues. In some instances, it may look like they're actually working against management and taking a view that are not necessarily going to help things transition smoothly into the next period. And again, so when all of these things are considered at the moment, and we look at risk overall in terms of, you know, from strategy all the way to reporting risks in an organization, the Social and Ethics Committee is responsible to look after a big chunk of those exposures. So at this point in time, what we also see with regards to many entities is that they have not necessarily updated their formal risk registers. But one thing is for sure, there are a host of activities being taken by management to manage all sorts of issues at the moment. And one of the most important things they are managing is trying to comply with disaster management related regulations and not fall foul of those. You will also see management of competition laws on the agenda as well, and obviously the regulators are closely monitoring activities in that space. So those are very, very important aspects that need to be considered at this point. And given all of those issues being taken care of by management, as I've seen, there've been very little formal back to the drawing boards in terms of risk. And that is a very important thing that needs to take place, because right now we've seen a variety of responses when it comes to the assurance activities of organizations. We've seen some activities or organizations, in fact, say, one, we're deferring all assurance activities. So we see that happen. We also see assurance activities being reassigned to more important aspects. And we also see internal assurance activities being assigned to the second line of defense, helping management manage issues while they go through this process. But many objectives being focused on starting up and being operationally ready. So that's very, very important. You must also remember that all of the assurance activities that have in fact been assigned in the interim have been based on a business as usual type scenario, and therefore, you know, they don't necessarily cover what is in fact happening at the moment. So I think it's very, very important from a Social and Ethics Committee, and you can also just turn the page for me, please, for a Social and Ethics Committee to ask the questions that we've posed on the next page. So one, have you in fact updated the risk register? And what you may also very well notice is that, with the exception of the pandemic, which many companies did not have on their risk registers, let's say directly on it. So that was something. So this thing has hit most companies much harder than anyone ever would have envisaged. I think the issue is there are many risks which currently exist irrespective of COVID, but they are just significantly enhanced at the moment. And the questions that need to be asked by the Social and Ethics Committee in respect of safety, health, environment, social license, reputation and ethics, as well as social stakeholder related exposures, is exactly how has the risk register changed? What is the current status? And more importantly, when it comes to assurance aspects with regards to whether it's internal audit or other assurance activities that are needed to take place, how has that in fact changed? I think it's very important to understand all of those things. The other takeaway that I think is important from a management perspective is if they do not update these registers properly and then give the Social and Ethics Committee their portion of the register to oversee, the actual project management of the day-to-day activities, the completeness of those activities cannot necessarily be assured. So this is where the focus needs to be over the next period. And if we look at what is happening, the nature of the assurance that we see popping up on the radar at the moment is compliance with the actual Disaster Management Act and all of those requirements. We are seeing a number of cybersecurity reviews that are being performed. We've also seen a number of clients that have been compromised in the last 60 days as well in terms of cyber activity. And then the other thing is operational readiness and business continuity management. We're seeing a lot more of that activity on assurance plans with regards to whether or not the supply chain can be remained intact, and how we are taking alternative measures to ensure that we don't fall foul in the event that we cannot secure supply, etc. And you will also have noticed that in terms of certain technology procurement at the moment, there's some things you just can't get in the country because they've been sold out because of the new way of working. People have bought up all the webcams that exist. You cannot get them, and now there's a big shortage in that front. So those would be the important aspects that I'd like to leave you with as we hand over to my other colleagues to take this discussion further. Thank you very much, and good luck with your COVID activities. Sandra, over to you.
Hi, thank you so much, Dane. If Telly can just show us for a brief minute what the outcomes of the poll is, just to get an indication of how many people have had their risk registered reassessed during this time, and so that we can also see how much work still needs to be done. Telly, do you have those results with you? Okay, I think maybe we don't have that outcome from Telly as yet. I think in closing from you, Dane, from my side, I would just say that if you're a member of a social and ethics committee and you know what you now know after this session, what are the top 2 things you would go back to your executives and say, you know, I want to see these 2 top things, or I want to consider these top 2 things?
Well, for me, I think because the overall ambit technically is sustainability in general, but also focusing on health and the like, I'd want to understand exactly how management has reassessed risk pertaining to health, safety, environment, and all the aspects that fall under the remit of the Social and Ethics Committee. And I'd also like to get a good understanding on how those changes to the risk landscape have in fact transpired in terms of a realigned assurance strategy. And that's not only external assurance, you know, even the external auditors are reassessing risk at this point in time. They're going to look at sustainability, going concern risk, and post events a lot closer in their current audits. You know, the internal audit plan needs to be revised. And then more importantly, there's a whole host of line 2 assurance which management need to be taking from a corporate perspective across their organizations, as well as reassessing things at a line, a level 1 from a management control perspective. So I think it's a whole integrated approach that needs to be taken to manage these COVID risks that have come out of the woodwork. And I think the Social and Ethics Committee need to ask those questions as we posed.
Thank you so much, Dane. I think that was very useful, and at least some thought for members of the Social and Ethics Committee. Next up, we have Fedi, who will take us through the OHS considerations. And Fedi is an Associate Director in the PwC's Sustainable and Climate Change team. He has 18 years experience in the field of safety, health, environment, risk and quality management. He has an excess of 6,000 ISO 14001 and OHS ISO 18001 certification audit hours. He established PwC certification, which is now the BSI South Africa, the Assessment, Retirement and Mine Closure Ability Assessment Unit as support of PwC's statutory audits. The core experience that Fedi has is safety, health and environmental management, certification audits, environmental legal compliance and due diligence audits, groundwater pollution management, liability assessment and audits, contaminated land, asset retirement obligations and closure liability reviews. Fedi brings with him a wealth of experience and also qualifications. He holds a BSc honors and then a master's in environmental management and analysis. He also holds a PhD in geology. He's a registered professional natural scientist with the Council of Natural Sciences in South Africa. Ladies and gentlemen, can we please welcome Fedi to take us through the considerations.
Good morning, everybody. It's a privilege to speak with you. I do hope that my session do provide you on some compliance insight pertaining to occupational health and safety and the consequences that COVID-19 has to management systems. The COVID-19 outbreak has a significant impact on the way companies work and subsequent impacts on the effectiveness of occupational health and safety management systems. And the impact on the regulatory adherence and changes in COVID-19 related occupational health and safety legislation is a very, very topical matter, obviously, currently that we have to deal with. The Minister of Employment and Labour has issued a directive to provide for occupational health and safety measures to reduce and to eliminate the escalation of COVID-19 infections in workplaces. The provisions of the directive specifically apply to employers and workers involved in the manufacturing of essential goods and providers of essential services, and will remain in force for the duration of the national state of disaster. The directive was issued to ensure compliance with the Occupational Health and Safety Act, which requires that every employer must provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk for its employees. The Occupational Health and Safety Act obviously further requires employers to ensure, as far as reasonably practicable, that all persons who may be directly affected by the activities, such as customers, clients, or contractors and their workers who enter the workplace or come into contact with the employees, are not exposed to hazards to the health and safety. As Dane has indicated as well, start-up procedures must address measures to be taken to prevent the spread of COVID-19, as well as actions to provide a safe working environment, especially following the prolonged closure of some of the operations that we have seen. These regulations focus specifically on a number of minimum aspects, and I want to emphasize the word minimum here. I will expand a little bit later in one of the slides some thought leadership with regard to aspects that I do think is also important to consider. But as a minimum regulatory requirement, the following are the key focus areas that this regulation basically stipulates. The first one is administrative measures, social distancing measures, health and safety related measures, sanitizers, disinfectants and other measures, cloth masks, measures to which the public have access, and then ventilation. You may move me to the next slide. I will briefly just go through the key requirements. I do think it's quite important as a basis that we understand what the minimum regulatory requirements are currently. There's a need to update occupational health and safety risk assessments with specific focus on COVID-19 risks. And I want to emphasize here that if we look at this regulation, it's very much physically based. There is a lot of other matters pertaining to health and welfare of employees that we also need to consider with regard to these specific risk assessments. And in those risk assessments that we have seen, we see that a lot of those specific risks are typically omitted simply just to comply to the legal requirements, which might be problematic. There's a need to develop a written policy and to submit that to the Department of Employment and Labour if you've got more than 500 employees employed. The feedback that we have seen, on some of those policies that's been submitted is that the feedback from the department in some instances isn't great. And again, there's an opportunity there to ensure that those specific policies also deals with employee welfare and the psychosocial related aspects pertaining to the employees. There's a need to notify employees on information such as not to attend work should they feel sick, implement monitoring and supervision to ensure measures are complied with, minimize the number of workers in the workplace at any given time, and to minimize contact between workers as well as between workers and the members of the public. Next slide, please. Social distancing measures arrange the workplace to ensure minimal contact between workers and, as far as practicable, ensure that there is a minimum of 1.5 meters between workers while they are working. This is quite a big challenge, especially in certain industries where we see packaging activities and where people don't have adequate space, for the employees actually to perform certain activities. Arrange physical barriers to be placed between workstations or erected workstations, and then to ensure that social distancing measures are implemented through supervision both in the workplace, such as canteens, lavatories, bathroom facilities, and in the common areas outside of the immediate workplace through queue control. There's a need to screen, obviously, every worker on reporting for work, require that every worker report any illness or symptoms, make a provision for quarantine facilities for employees showing signs of COVID-19, and not to permit any worker with symptoms to enter the workplace or report to work. There is a need to supply sufficient quantities of sanitizers, basically in the workplace. I think quite a big challenge currently is that there's a lot of products on the market. A lot of these products haven't been certified as really being effective. There's been a big flood with new companies or existing companies starting to develop and to produce some of these disinfectants. It's worthwhile to ensure that those sanitizers and disinfectants are effectively manufactured to ensure safety and its effective intended use. There's a need to ensure that all work surfaces and equipment are disinfected before work begins and regular during the working period and after work ends. There's also a need to disable biometric systems or make them COVID-19 proof, especially with regard to hand contact to specific access control related systems. Ensure that there are adequate facilities for washing of hands with soap and clean water, especially warm water in some of the bathroom facilities. There are measures in respect of workplaces to which the public has access that needs to be considered. Ensure that public access in general are limited when it is actually not needed for the public to access the workplace. There needs to be physical barriers in place for workers with face shields or visors. We see this quite a lot in our retail shops currently, where we do see the visors, etc., but it's important that those are adequately designed to protect the employees from the risk of people contaminating them. Undertake symptom screening measures of persons other than employees entering the workplace, to display notices advising persons other than employees entering the workplace of precautions they are required to observe while in the workplace, and require members of the public, including suppliers, to wear masks when inside their specific premises. Then just with regard to ventilation, this is quite a complex area, and there's a number of specialists obviously that deal with occupational hygiene related aspects, but the workplace needs to be ventilated quite well. There are technical requirements with regard to the type of extraction ventilation systems that needs to be in place, such as high efficiency particulate air filters that needs to be implemented, maintained, and serviced in a frequent way. Windows should be accessible and should be typically open, to assist with adequate ventilation, and ensure that filters are cleaned and replaced in accordance with the manufacturer's instructions by a competent person. And obviously, the waste generated by that filters is deemed hazardous waste and need to be disposed in appropriate measures. I'm quickly going to speak a bit about thought leadership. That first few slides just talk about the minimum regulatory requirements, and I want to share with you a few thoughts with regard to occupational health and safety management system considerations and then employee welfare. I'll focus on the context of the organization, leadership, planning, support, operation, and then performance evaluation on a few thoughts that I do have. With the global impact of COVID-19, the context of the organization is likely to have changed or at least been impacted, and it may change more permanently once the crisis has passed. The scope of application of health and safety has therefore been expanded beyond boundaries that we've experienced before. The needs and expectations of workers and other interested parties needs to be considered in the context of COVID-19. Workers will obviously have direct needs and expectations, as will stakeholders such as patients, clients, visitors, suppliers, the public, and even health authorities and regulators. Additionally, with COVID-19, it will be necessary to consider families, particularly those with vulnerable dependents who may be at increased risk of becoming infected or may require extended care if they actually becomes ill. Then with regard to leadership, executive management must demonstrate leadership and commitment, ensuring that occupational health and safety management systems are integrated with other businesses' processes, and that the necessary resources are in place to ensure its actual effectiveness. And I want to place emphasis here on effectiveness. I do think that a lot of these management systems are designed to meet basic regulatory requirements, but the effectiveness of management systems in occupational health and safety has never been as important as it is currently in dealing with the COVID-19 related threats. Executive management must also ensure that the roles, responsibilities, and authorities are assigned, and that the people to which those roles and responsibilities are assigned are competent in actually executing them. There's a big difference being trained and competent, understanding exactly what you require to execute. In relation to COVID-19, there might be specific roles, responsibilities, and authorities required. This may be additional authority to line managers to let workers work from home during an incident, liaison with health authorities, or even a specific pandemic or outbreak management teams are required, to manage those specific aspects, and authorities need to be assigned to them. Consultation and participation of workers would need to include COVID-19 risk management activities. And in South Africa, with a number of our unions, etc., the consultation and participation of workers in adopting the risk assessments, the controls that we are implementing, is currently extremely important to get that buy-in and that consultative process in ensuring that people adopt these specific policies and measures that's being implemented. On the planning, I just want to quickly speak about hazard identification and then specific legal requirements. COVID-19 hazard and risk should obviously be identified. It's a regulatory requirement. This should be normal, abnormal, and include foreseeable emergency conditions. Non-routine activities and situations should be considered. Emergency situations, people, situations not controlled by the organization, and changes in knowledge and information about hazards as new information becomes available. Other hazards may also change or increase, such as violence, stress, fatigue, home working, social and psychological factors also need to be considered in our hazard identification and risk assessment processes. Then with regard to legal and other requirements, the risk management of COVID-19 may be covered by specific legislation, particularly health and safety legislation related to hazardous substances or biological agents. Governments may issue additional information, guidance, or even emergency legislation. Health authorities such as the World Health Organization will also provide regular updates. It is therefore essential that processes be established for identifying these, keeping it up to date, and making sure that the specific legal requirements are implemented in appropriate timeframes to ensure compliance to legal requirements, but also to expand the needs and the risk associated with our occupational health and safety management systems and employee welfare in order to ensure that our systems and processes remains effective. Then just with regard to support, and here I will focus on competency and communication. The necessary resources, competency, awareness, and communication will be required in relation to COVID-19. This may mean additional hand sanitizers, licenses for remote access to computer systems, repatriation mechanisms, access to additional health expertise, emotional and psychological support, guidance on working at home, etc. Resources in particular should be carefully reviewed. Critical workers should be identified, and the implications of their absence should be assessed, even if they do get sick from COVID-19. Do we have a response system to that in order to ensure that our critical workers and tasks, remain effective and efficient in place? Then, with regard to competency, needs not to be overlooked. Workers may be asked to cover other roles, or additional temporary workers might need to be brought in. Do they have the right or the correct competency and training to execute the tasks appropriately? Do they understand the hazards and the risks and the controls? There may be a temptation to reduce inductions and training, but the health and safety implications of this should be carefully assessed in order to ensure that our staff complement remain competent and aware. I think exceptionally important during this time is communication. Regard should be taken with regard to internal and external communication. Timely, regular, and proportionate communication to workers and other people such as patients, family, and the supply chain that informs and reassures them is essential with regard to our controls and the risk associated to COVID-19. External communication also needs to be carefully considered to keep clients, shareholders, and others informed. This should include the management of social media and identifying a company spokesperson, including someone from executive management to oversee the specific process. I'm then going to focus just on operation, and the key focus for me here is emergency preparedness. Obviously, with regard to our hazard identification and risk assessment process, we will have procedures and operational controls that will be implemented in the operation with regard to typical day-to-day task and risk-related activities in order to eliminate the specific risk pertaining to COVID-19. Those needs to be designed appropriately, rolled out, and people should be competent in executing those specific operational controls. With regard to emergency preparedness plans should be identified and communicable pertaining to specific COVID-19 threats that might be in the company, any exposures, and any foreseeable disruptions in the actual business. Emergency plans should also be reviewed and updated, as actual incidents pertaining to COVID-19 do occur in the operations. And I think what is important, and Dane touched on this, is business continuity. There's a very strong linkage that we're seeing currently with regard to business continuity management systems, ISO 22301, and occupational health and safety management with regard to emergency, the actual exposure of employees and cases in a company, how that is being dealt with and how it impacts business continuity as well. Then Dane touched on performance evaluation. Obviously, the internal audit plan with regard to the effectiveness of management systems, the adequacy of risk and hazards, needs to be evaluated. There is a need to increase probably the review, the regulatory adherence pertaining to COVID-19 legislation, the effectiveness of our management systems, and then the need, for any specific gaps pertaining to COVID-19 and where we can be exposed. Then in general, with regard to improvement, I also think it's quite important, for management to reconvene more frequently to understand, what is the impact on the business, and from COVID-19, what are those issues that we can improve on, and to make sure that our people are more effectively covered with regard to risk to COVID-19 and employee welfare as well. I just want to close off by saying that the current abnormal occupational health and safety conditions relating to COVID-19 will become tomorrow's normal occupational health and safety conditions. This virus currently doesn't seem to be going away in the next year or the next 2 years. What we see as abnormal now will become normal in future. Thank you very much.
Lusanda, you're on mute.
Thank you, Fedi. Thank you for your insightful input. I'd like to remind all the guests to please write their questions on the top right-hand corner, and also to remind everybody to please switch off your video just to help us with the bandwidth. So Boitumelo will just take us through some of the ethical and fraud considerations during this time. Boitumelo is a director in the Forensic Services Division in Gauteng, and she specializes in fraud risk consulting and fraud investigations. She is a certified fraud examiner and has got a combined 13 years experience in forensic investigations. She leads a couple of fraud risk consulting engagement, and she also is a guest lecturer at the University of Pretoria on the fraud risk management subject. Boitumelo also does guest speaker at conferences, including Association of Fraud Examiners. Ladies and gentlemen, please help me welcome Boitumelo and as she takes us through fraud risk and forensic considerations.
Thank you, Lusanda. Okay, next slide. Okay. So I think one of the most important things, especially in the face of a crisis, is that it is hard enough, without having a crisis in place to make ethical business decisions. So if you add a crisis to this, you do have what we call a perfect storm to it. So it's important more than ever now that those who are responsible for the ethics decision making and also just business decision making ensure that the ethical aspect of it is not ignored. And really, when you look at the two top ethical risks that came out of the Ethics Institute 2019 business survey, two top risks were the first one, lack of ethics, accountability, and responsibility. And this really touches, it's a pain point on the ethics, your social and ethics committees, one of the responsibilities from an oversight perspective. And this was also identified as one of the top ethical risks. The second one is really lack of ethical treatment of employees. And I will go back and touch on Ferdy, the previous speaker's issues around health and safety. In respect of this ethical risk, one is the safety aspect, whereby employees felt that their employers are not providing safe and healthy working environments. And this is at the onset or even prior to COVID. You can imagine now with this COVID and the heightened regulatory requirements from a safety and safety and environmental aspects, it will then become very much prudent, especially from a social and ethics committee perspective, to ensure that this risk doesn't manifest and doesn't get to a point whereby it becomes an ethical failure. One of the other issues in respect of ethical treatment of employees is ethical treatment, which includes general inclusion of employees in making decision. And you can realize that, especially with what Dane said earlier on, there has been, a heightened risk in terms of employees working from home. Over and above that, it's the aspect relating to how are employees coping with being isolated, and also treating them with courtesy, respect, and dignity. So that was one of the top risks that were basically identified. And the reason, it's being emphasized now is this was pre-COVID. Take a COVID spin-off into it, and then you will see that there will be ethical dilemmas that come out of this in terms of now organizations need to decide and also manage the recovery into the mid and to the long term. And it also speaks to Ferdy's point to say, this is not going away anytime soon. And, the projections that Lulu, our chief economist, showed earlier on really does allude to the fact that we are in this pandemic, and it is now more than ever that those who are charged with governance ensure that that is heightened and it is more at a top of mind more than ever. Next slide, Telly. Okay, so even before that pandemic itself, about 42% of South African respondents to our 23rd, which is the PwC 23rd annual Global CEO survey, they had said that they're not confident about the prospects of revenue growth over the next 12 months. So this is at a situation, at a point where we didn't have this crisis. There was already uncertainties around growth, around revenue, around even making or meeting certain performance demands for business. And I think Lulu really alluded to that fact that this is, we had an issue, we had a situation even before COVID, but now it has basically worsened because of the pandemic itself. As I said, at the best of times, it's hard to deal with a dilemma. And then you add a pandemic situation to it, you've got a whole new perfect storm to it. Particularly, the Social and Ethics Committee, also including business management executives, need to make very tough decisions. And these tough decisions relates to really balancing the stakeholder interests, your employees, customers, clients, suppliers, government, especially, having declared a state of a national disaster where there's certain regulations that are coming in on a daily basis, updated draft frameworks. We are inundated with information. At the same time, we need to be at the forefront and need to be making sure that all of those are basically updated. And really going back to Freddie's point to say, there are heightened regulatory requirements, and with that comes in making sure that those are complied with. And with compliance also comes with the assessment, going back to Dane's point to say, are these risk registers, as it relates to all of these emerging risks that are coming, are they then being updated accordingly? Also, one of the most important aspects from a social and ethics perspective is the communities in which the business are operating in. So I'll start off with what the grappling issues that business, and also, from a perspective of making sure that ethical business decisions are made. One of the biggest issues that business had to grapple with is people versus profits. It's hard to know how to approach the dilemma in the best of times, and organizations have had to grapple with questions such as, can we afford to pay all our staff, or would it be better to let go some of them? Also, in letting go some of them, we are also are we protecting the interest of the business? Are we also considering things such as job security for our employees? And in all of that, there is that ethical dilemma into it, to say, you're thinking about the people, at the same time you're also thinking about the business. Which one comes first? So that balancing act in making those decisions has been such a difficulty or a challenge from a making a decision point of view. Questions such as, do we give our staff raise, or would it be prudent for us to save cash now in case things get worse? Because everything is so uncertain, it ends up being an interest on one side. And the question is, with all these stakeholders that I have indicated, which one will then come first? Who do you save? What do you save? And where do you start? Lulu made some projections and some scenarios there, and that is where a lot of companies are grappling with these situations, to say, what if things get worse? Are we suspending salary increases? Are we suspending any bonuses? Are we freezing or suspending any investment that we were planning to embark on in the current financial year, or even for the next sorry for the up until a point where we know where we are going? Every single day scenarios are changing, and these are the kind of issues that from a social and ethical perspective, these are the decisions and the dilemmas that organizations are facing. I won't talk much about the health and safety aspects out of it, because I think Freddie covered it quite well, and those are the kind of things that businesses had to grapple with and make decisions. In that, you've got employees that are working from home. Do you then immediately tell them to come back, at the face of the fact that you need to start making profits? Or do you then ensure that before employees even come back, there are all those measures that are made in place because you do not want to be in a situation whereby you are found to be non-complying? I mean, drastic measures as put by government has been needed to be implemented to mitigate the risk of all these health risks. And on top of that, it is really a business decision, and it's really one that can make business face a dilemma in the best of times. The other question that businesses have had to ask is, do we have enough revenue to continue with the project, or should we only focus on core business? And even on focusing core business, then does that mean that we are significantly going to change the employees' workloads? Does it then mean that we are going to cut their salaries? Now you are bordering onto labor matters. Or does it mean that we embark on a retrenchment process? So those are very much difficult decisions. And, these are the kind of decisions and business, these are the kind of business decisions that will have to be made. And it's not only going to stop now, or it's not something that at some point we know when these will always be, when businesses will be confronted with these issues. So from that perspective, it's quite tough. And I think from a committee perspective, it would be from a basis of ensuring that the most important thing is that overarching the health and safety of the employees. If you can get to the next phase. All right. So really, I think in conclusion is, one, it's important that in facing a crisis like this, is to prepare, respond, and emerge stronger. In preparing is building the resilience before the crisis hits. Secondly, continuously assess and manage the crisis effectively and rapidly. Thirdly, resolve, recover from the crisis. One of the most important, and I think very much key, as indicated, is that one of the things that the Social and Ethics Committee needs to start really looking into is to say, is really our ethics strategy aligned with what is happening in terms of the crisis? Do we even have an ethics crisis management plan in place? And secondly, what kind of the ethical interventions are there, not only on a general basis, but to be able to respond to the COVID-19 agenda item? So really, that is basically what I wanted to share with you colleagues, and thank you for this opportunity.
Thank you so much, Buitumelo, on those considerations for us. I think next on our lineup is Junaid, and Junaid will just give us some cybersecurity and fraud concerns to take into account. Junaid is a partner in our advisory division, and he is responsible for cybercrime investigations and incident response management services in Africa. I think he's done a lot of work around cybercrime investigations, incident response, cybersecurity operation models and design and implications, ethical hacking reviews, social engineering, and IT governance implementation. I think, ladies and gentlemen, please help me to welcome Junaid, who will all really give us some considerations as far as cybersecurity during this time.
Hi, good morning, everyone, and thanks, Lusanda, for that intro. I think just from a cybersecurity perspective, and I'll try and be brief given the time, is really the attacks haven't changed significantly during this COVID period, but what we are seeing is that attackers are starting to modify the attacks. So I think they also, if you're looking at the chatter on the dark web, and that the attackers are also finding it tight from a financial perspective. They rely a lot on travelers through credit card fraud, etc., to fund their activities, and a lot of those streams have dried up in this period. So they are looking to get a bit more inventive in terms of the attacks that they are carrying out. We've seen approximately about 100 to 150% increase in attacks on the health sector. We've seen hospitals in Czech Republic where they've effectively deployed ransomware that's encrypted all of the information on COVID testing centers, or it was actually one large hospital, and it effectively stopped operations in that site. From a South African perspective, we've had a private healthcare facility where patient records and scans were also held to ransom in a similar fashion. And in the UK, we've seen an attack fairly recently on a construction company that's helping the government build hospitals, right? In terms of the attacks that we're seeing in these, so there's really two attackers. You have nation states, that's government sponsored hackers, and your cyber criminals. The nation states at this point are, nation state sponsored hackers are effectively looking for research into vaccines for COVID. And interestingly enough, something else that started to trend in that space is that we're seeing actually a race to get to the Arctic. So shipbuilding facilities where you're building ships with ice-breaking capability are also starting to be attacked by governments in that space. If we're looking in the cyber criminal space, they effectively using social engineering to get people to click on links, download software. So that's how they're perpetrating ransomware and phishing attacks. In the last 2 or 3 weeks, we've seen over 1,000 domains that have been registered. So these domains, these websites are effectively derivatives of the word COVID. So what it means is that they're going to start launching attacks. They've already started sending out, even using these web pages that are coming up that ask to fund vaccines. So they pose as Centers for Disease Control in various countries and looking for funding to fund vaccines, and they're collecting money from people through those attacks. The other one that's new in this period is where they're sending out Excel documents with macros claiming to have COVID information in them. When you open the document, it starts installing malware on that, on your PCs. The other risk that we're seeing starting to come up is as there's uncertainty from a job perspective, your threat of insider threats where employees might leak intellectual property, sell intellectual property, or if they're looking to shift to competitors, taking that information with them. So what it means is that IT needs to really restrict the people's access to what's required for their day-to-day operations. And probably the one that's concerning the last point is what we're finding is 47% of IT security teams have been shifted to other duties during this period, and that's concerning because this is the time we actually need them from a monitoring perspective there. So in summary, that's pretty much what's happening out there right now. Lusanda, that's pretty much all from my side. Thank you.
Thank you so much, Junaid. And I think the points that you've gone through are things that we probably never thought of, but are very concerning. And we really appreciate that input from your side. Our last speaker is Ellen, and Ellen will give us some considerations as far as reputational risk is concerned, but most importantly, resilience through this process. So Ellen Agal is a former senior journalist, communications manager for BMW South Africa, and a managing director at a JSE-listed advisory firm. He has consulted in more than half of the JSE top 40 companies and provided executive counsel and advisory services for more than 200 real-life crises. He has delivered more than 1,000 executive media training sessions, conducted reputational risk audits for numerous listed enterprises. Right now, Alan is intimately involved with the communication and reputation management elements of COVID-19 from the first infection that happened in South Africa. He has drafted crisis leadership playbooks to help organizations navigate the impacts and outcomes of coronavirus. He serves currently in the Business for South Africa Communications Task Team, leading organized business response to the virus. Ladies and gentlemen, I think we can all agree that Ellen is someone that we really would be interested to hear what he has to say in the time of this crisis. Ellen?
Thanks, Lusanda. If we can have the next slide, please. So I often use this metaphor of snakes in the field of crisis leadership, and often we have this perspective that crises are like mambas. They are fast striking, they come out, surprise us, unexpected, highly lethal, one bite, 30 seconds later, you're really reeling. When in reality, and and the stats would bear it out, the majority of crises facing organizations are actually more of the Python variety. They're slow moving. The warning signs are there. If we can have the next slide, we'll just reinforce. So Institute of Crisis Management, US organization, every year they look at close to 800,000 negative news stories, and every year the same kind of stats come through. 3/4 of crises of the Python variety. They are smoldering, the warning signs. If we think about COVID-19 and just how far back people were warning about this, but certainly it preceded December 2019. President Trump might have a different view of that, but I won't go there given our limited time. So they are typically smoldering, and if we can have the build there, they're not only smoldering, they generally originate inside our own buildings. So you as non-exec directors of many companies, 2/3 of crises typically originate from within, from executive misconduct, from employee misconduct, rather than being external outside forces. Obviously, COVID-19 has shifted things. There's only really one story in the room right now, and that is the pandemic, and that is an outside force. But if you look at your Business Day, Financial Mail front pages, pre-Feb and hopefully post-September, they are going to reflect majority start inside the building. Next one, please. So what can we do? I don't have time to get into much detail around here, but if the majority of crises are smoldering, what early alert systems, what's the culture like at the companies where you sit on the boards in terms of encouraging people to talk up, to give you a sense of this is perhaps going wrong? Are you doing not only a risk audit, as we've heard from many of the speakers, but looking at it through a reputational lens? Just by way of one example, and I don't want to identify the company, so I'll say in the last 24 months, looked at the pre-listing statement for a company coming onto the JSE, 300 odd pages, 7 pages of risk, all very astute stuff. But looking at it a reputational lens, 15 areas where perhaps needed to just look at it perhaps slightly differently. For example, one of the non-execs listed as a non-exec at this listing company, serving on 43 different boards. Nobody had picked that up as perhaps something that people would have concerns around, being able to allocate time, energy to that particular company. Their head office, a multinational working across Africa, but their head office based in the Middle East. How would that play out with their constituencies? Have you got playbooks in place? Spent a lot of time beginning of this pandemic just getting, sounds a terribly twee expression, playbooks for something so serious, but who are your stakeholders for COVID-19? Do you have draft collateral in place to communicate infections to colleagues, to communicate when, heaven forbid, but it's likely these days, and as we move towards peak in September, do you have communications collateral about a death in the building, in the office, one of their colleagues? What responsibility is it governance to communicate? When is it your responsibility as an enterprise to communicate? And then simulation. So next week, doing, once again, multinational, taking time out now to see how their crisis leadership team is able to collaborate online in this new remote world for 4 different scenarios, simulation. Next one, please. Did risk audits November last year of 120 top companies, 40 top companies, New York Stock Exchange, 40 London, 40 JSE, top 40. Looking at their risk registers, to Janae's point, cyber right up there is the top risk, regulatory second highest. Interesting, reputation, either as a principal risk or a consequential risk, right up there. Back in November, only 5 of those 120 global top companies had pandemic or epidemic in their risk registers. I've just finished doing it for now their 2019 integrated reports, just looking at South Africa. Up to now, 8 companies are ready, and obviously that's going to just get more manifest from those global companies' perspective. But what does your risk register look like now? And then just moving forward, just as I've emphasized, what kind of collateral preparation is in place as infections spike, as fatalities start spiking, as people start getting retrenched in greater volumes, as people have to perhaps take unpaid leave. How are your companies going to be communicating that and ensuring that they aren't being seen to be unethical, as damaging your reputation in that process? And when do you start, if ever, in this year to communicate business as usual activities? When is it appropriate? When would it be seen as just not the right tone to be doing it? Last one, please. Once again, don't want to be twee when we've got over 350,000 global deaths, but as Winston Churchill said, never let a good crisis go to waste. So the Chinese symbols, allegedly, it's not quite that, but for crisis, those two on the left, the first represents danger, the second represents opportunity. Is this a time where you can get systems, processes, protocols in place where your leadership can come through this and be cited as best practice in the way they handled this crisis, as being empathetic, tone at the top, absolutely on point? So is this a time now where you can actually build resilience and build your reputation moving forward? So a little rushed, but hopefully a couple of things you can go and ask back of your boards, of your excos. Do they have protocols in place? Are they sufficiently rehearsed? Do they have the right crisis leadership team in place? All those kind of issues moving forward. Thank you.
Thank you so much, Ellen, for that input. And I think the important thing is that as you are in the crisis management as we speak, you are talking about things that you've seen. But from my side, I think something very important to really think about, especially for the Social and Ethics Committee, is to just give you a result of the poll that we did. And it will show you that there's a lot of work that still needs to be done by the Social and Ethics Committee. So the question which Dane asked is that, has your Social and Ethics Committee received an updated risk register and realigned short-term assurance plan for the risk areas that it is responsible for overseeing? So if I look at the outcomes of that poll in this room, only 70% says, yes, the register was updated and realigned, the assurance plan approved. 17% says, yes, the register was updated, but assurance plan has not been realigned. And then a staggering 67% says, no, we're waiting for both the risk register to be updated and to realign the assurance plan. Now, if we look at that, I think it's an indication that as a social and ethics committees, there's still a lot to do. And we hope that this session has sort of helped to actually start opening up that thinking to say, what we should be reassessing and how we should be realigning the assurance work that's being done. I haven't seen any questions on the side for the panel, but just to say to you that this session has been recorded. So the slide deck itself will be sent to the participants and the recording of this session. I don't know if there's any question that someone is thinking of right now before we thank all our panel members. Okay. So I don't see, oh, there's a question. All right, I think the question is just coming up just now. Let me just have a look at those two questions. So I think for this question is for Fedi. It's just asking about quarantine facilities that business must provide. So from your side, Fedi, are there minimum requirements which companies need to really think about, and most importantly, providing quarantine facilities for the employees?
Yes, thank you very much for that question. It's quite a good question. My comment on that is what we have seen is that, especially in the mining industry, the mining companies have identified certain guest houses who obviously meet, some requirements that they've established themselves with regard to public safety, sanitizers, etc., some quarantine facilities. So yes, there is an obligation, to identify quarantine facilities if employees do test positive, for COVID-19, and obviously if there's any specific, potential exposures to the employees.
All right. Thanks for that, Fedi. I think we've just got 2 minutes to close, and maybe I will close now because we don't have more questions on the question bank. Just half a minute from the panel members if there's a closing remark. I'm strictly 30 seconds, actually not even half a minute. Okay, so I'd just like to thank all the participants for joining us, and we will send both the deck and the recording to you shortly, I think during the course of this week. And we really do hope that the session was very helpful, but particularly had got you thinking as a member of a social and ethics committee on things that you should go back to your entities and ask of your executive members. Thank you so much for joining us. We really do appreciate it. Thank you.